and welcome to Olsem Wanem. I'm Florence John Duo. March the 24th marks World Tuberculosis Day. Here in Papua New Guinea, tuberculosis remains the leading disease. PNG also ranks number 10 in the world in terms of TB and number 1 in the Western Pacific region. In this episode, we explore the symptoms, the treatment, the challenges, as well as the efforts and progress in terms of addressing tuberculosis in PNG.
Sabe blomi emosem, igat ma papa blomi sa toki mi osem TB, em sa run through lo blood. But they never told me that TB ino sa kiliman, em got kiwa. What also talk em, although they don't have experience in TB, so what also talk TB no good plasi, em sa kiliman, and that's what I used to hear. So time mi harimos em mi got this la sick TB, em mi shock na mi cry.
I was in fear. I was thinking all my friends in the community and even my husband, they'll all by looking me now, all by let's look I'm close to me or like that. Because I have a little baby too in the house too. I was thinking all by let's look I'm close to me. Even all tambuline me too, me thinking all by looking me now, by gossip me or this like kind like me got this like sick TV na. Me poret na. Me even me just feel the same. Vaccine marasin no, nugu to luki mixi marasin tu na, all but no can go close to Lomira or like so I'll be like lonely, I'll be on my own, without someone beside me. Even my friends, my husband, all tambula in me.
The challenge is, I think the fundamental challenge remains stigma. That there's still this feeling that it's a terrible disease and people die from it.
Mi play no like Olsem, online got TV longen. You play separating plate, cup, spoon, and this play no got. Usual way. TV no sabe spread lo this play way. Diploma Randy Moke, me TB physician lo Potmos Regional Hospital. Now me mainly work one time with TB patients. Science blow TB and Olsem. The main one and you by kus, okay? And the main area TB are affecting lungs of entry, airway. So EMSA go stop long hop. Now from there, we can develop over time. So the main sign blow TB and cough, kus. So line kus plant, and usually we can take him 2 weeks or more. So online kus color blow you go green, go yellow. Some time one time some blood. You look him this blood or some time you experience chest pain, breast pain. Kus planty one time this blood. Or line you lose him skin. Throughout nothing on night or some you sleep now you wet him pillow or bed sheet blow you. And then you start losing skin. Can get good. Then you start thinking. And can be TB. So you need to go check up.
My name is Anna, and I first got this sick TB, and then I didn't even knew that I got that sick TB. And then I started having those night sweats, and then I was coughing for almost 3 weeks. 3 weeks coughing, and then I was having chest pain. Lewa blomi start pain. So lewa blomi start pain na. Mr. Plaus, I was thinking that I was having maybe malaria or pneumonia or something like that. I didn't even knew that I got that sick TB.
You got two kind TB. One blood, we call him pulmonary TB or market TB. This TB infectious. Infectious. Can spread through long coughs or sneezing. Can spread through easily. So this blood we call him market TB. All right. TB, not blood TB, outside lungs, wind bag. This plan we call him lo English extra pulmonary TB. Extra pulmonary TB a minimum outside lo lungs or TB blow you yet a minimum is la TB blow you yet and by affecting you tasol na emiken bagarab you tasol emino naplong bagarab ngol narpla manmeri or spreading golo narpla manmeri. So TB outside lo lungs, you know, napla spread golo narpla manmeri.
My mom, Jennifer Sarapo, is a TB volunteer at Los Road Clinic. So she saw me and she knew that I got that sick TB. And then I'm coming and talking to me, we'll have to check you, test you first and see if you have TB because all the signs and symptoms that you are facing now, it's all signs and symptoms for TB. Yeah? So maybe I have to check you past them, whether you got, because what you are telling me is you are having night sweats, you are coughing for almost 3 weeks now. And then I started losing weight. When I started losing weight now, my mom saw me and she said, I think you have TB because I've experienced it too. And I'm a TB worker to volunteer too, so me can look him na Tokyo say you got sick TB. And then I was like, no, mommy, me no got sick TB. I'm okay. I'm malaria or I'm chest pain. And normally I have that chest pain too, so me took him and I'm sick blow me. I don't have TB.
Nimlo mi am Jennifer Sarapo. Is asleep lokoni. Okay. Sai lo pini meri blo mi. Mi been looking me Olsem. I'm oklo lose weight. So on Olsem mi been stop treatment sapota pinis. Na mi been experiencing me eto se mi been one TB patient before. So mi looking Olsem. I'm oklo lose weight. Na mi asking me Olsem got night sweats or no got em toki mi got night sweats na. Also, me looking more symptoms of TB. So, also me sa talking mem. I'm sa talk me no got TB. I'm sa talk also. So me just give him time. Me give him time me go, but that one plus time also me looking also me start lo cough now. And I la cough blame him also me more than 2 weeks yeah you tell him. So me talking mem oh, Anna, but me try me lo cap yeah, but me kissing cap come I'm try course blow you. So me looking more saying you lose weight all get na, you know look good so. Marasin to you drink or amoxicillin or Panadol or Wanem lo stopping pain na this like I'm no got. Never pain you stop yet so. But me try me look up. So me plus try more patient look up mixing cup quanta.
Welcome back. Tuberculosis remains a serious health issue in Papua New Guinea. The disease is often surrounded by stigma and discrimination, which can affect one's treatment and health. Avoid taking medication on a regular basis can have serious consequences. Such act can lead to multi-drug resistant TB, which is also a serious issue in the country.
Time you may look out him all lining at TB long end. Number one time through you may need to make him sure also only must kiss him good marsen long all long time straight. Only call him dot. Directly observe treatment. One family member or line belong him must make sure look at him good ego enough and finish him good marsen or some doctor mark him long end. This la man Mary he got TB long end only no can lose him marsen. And big pla talk me play like encourage him or family member. He must support him all line he got TB long end. Number two, or line family need to make sure also only give him good kaige long all kaige block garden or some only must nutrition food.
So first time me drink this la marasinia, me feeling more than 16 is too much for me. So me that second, third, fourth day me less to drink marasina me losing. But then all house line is pining me now and more strong me carry me go around house sick now. You got all nurse na Wanem lape all astronomy kena mi start lo kisi marasin kena.
My mom was the first one to support me to take the medicine.
Time mi pla find out Olsem it's putin positive. Kaino se mol liglig blema. Olsem moli poret lo using same cup na all this la.
Mi pla no like Olsem aulani ka TB longen. You pla separating plate, cup, spoon, and this plakain no gat. Usual way. TB no sabe spread lo this plakain way.
My name's Heather McLeod and I work for World Vision PNG and I'm the country director for that organisation. I think the fundamental challenge remains stigma. That there's still this feeling that it's a terrible disease and people die from it. And that we also have these messages. Some people say that blame people on sorcery and all these other belief systems that come around the illness. And so for us, the biggest challenge is breaking through that stigma so that families and communities are supporting patients. And the next one is really that continuing that treatment. It's hard to continue treatment for that period of time. I mean, many of us have probably been to a doctor and had antibiotics for a few days and we've been told we have to keep taking it for 5 days or 7 days, and we do that, and when it's done we're so pleased we don't have to take these tablets every day. TB patients need to take it for months and months, and so that what we call loss to follow-up, so people stop coming for their treatment. They just, that for whatever reasons, and there's many reasons, that's one of the challenges all the organisations who are working on TB have, is this loss to follow-up.
We got plenty of patients in Zelo. Wanem settlement mistap. They on TB drugs now. So plenty also poretimol TB line. Misa tokimol Olsem. This la all talk lo kaike boy one time or using same kamban or half daga or half kaike yumi sharing or plate cup we share or sleeping together in one house. Olsem one house. Olsem mi work lo advice him Olsem. TB ino sa spread lo this la. You must like him all, walkie friend lo all. Now Olsem they will feel at home, they will feel like we got families around us. Now you play less lo all, now make him this la kind. All can lose him marasin, all can lose him life blood too.
But number one true, lo Papua New Guinea, drug resistant TB become true long. Planti man meri ino kisim good marasin. Planti man meri ino kisim good marasin, drug resistant TB become up lo this kind way. Planti kisim marasin, na only thing only alright finish, only stop marasin namel, na only no finish marasin good. Na this blood TB is our kera back. Na time me kera back emisawe. Tanim news face belong in and become up resistant. Now time he become up resistant, you give him this blood. Same marasin again, in an apple walk long all. Now you an apple kill him this blood pinatani die. Number one way. Number two way, drug resistant TB is our spread long end, Olsem. Or line is he got drug resistant TB, only cous, na easy, only passing me goal or lupla line, all healthy individuals. Now all these healthy individuals or line kissing TB before long end, only developing drug resistant TB for the first time. Almost our only kissing TB before, only kissing marasin before. That's all this plan. Drug resistant TB only kissing for the first time. For the first time, na this plan TB only got. So two kind way, drug resistant TB is spread.
This segment will look closely at some of the programs and organizations that are working in addressing TB in PNG.
Lifestyle disease to workload increase but TB is still leading. TB is still leading. So and one big problem. You may need to make him plan the work long this plan. So you may as healthcare workers, you may as all line family who are infected and affected, You need long work at work one time.
World Vision's been involved in tuberculosis work for some years now because tuberculosis is a key health concern in the country. And so as a key health concern, in particular, we're looking at the fact that about 25% of the patients are children 0 to 14 years. And so as child focused, of course, that concerns us. Not only that they're the patients, but also that in addition to that, you've got a lot of families with children in them who have TB. And when people are sick with TB, that affects the whole family, including children. And so for us, our real focus is how do we reduce TB in this country as a whole?
I'm Dr. John Flores. I'm the TB Grants Manager. Basically, I'm the one overseeing the operations department of the TB and Health Systems Strengthening Global Fund grant. It's a 2-year project. The project mainly supports the National Strategic Plan to control TB in Papua New Guinea. That's from 2015 to 2020. And all the activities in the grant are aligned with the 4 objectives. First one is to strengthen the local TB care and prevention. Number 2 is strengthen the programmatic implementation of drug-resistant TB. Third is to increase the coverage of HIV testing among TB patients. And the fourth is to strengthen the TB program in National Capital District. So I think 2 or 3 years ago, the government identified 30 priority health facilities. We also call them basic management units. So these 30 underperforming health facilities are currently being supported by mainly by World Vision, and the other 2 are actually MSF and DFAT. For the Global Fund, the focus is on the 28 priority health facilities in 12 provinces. Aside from that, we've identified 3 priority MDR-TB provinces, and that's NCD, Madang, and Morove provinces. And the government also identified 9 TB HIV provinces in the country. So the grant currently provides support to this 28 priority PMUs.
My name is Dr. Anne Clark, and I have been brought in to establish what is now called the Businesses for Health Tuberculosis Project. And my role as the project manager is to create a new organisation that engages the private sector in the tuberculosis response. So as you know, there's a lot of effort that goes into establishing systems and processes through the National Department of Health and all of those programs. And what we've noticed in the past was that a lot of that doesn't actually touch the lives and the thinking of the private sector. And a lot of those people aren't in places where we know Papua New Guinean communities are far-flung from Port Moresby. So what we make assumptions about what is understood by those in the private sector, I don't think necessarily connects with what goes on in the community. So the Businesses for Health Tuberculosis project will try to set up systems of communication with workplaces that put them in touch with how best to use the national TB response.
Papua New Guinea ranks number 10 in the world in terms of tuberculosis and number 1 in the Western Pacific region. This is according to WHO and the National Department of Health. Efforts have been made to address the issue. However, when dealing with tuberculosis, there is no quick fix.
My name is Dr. Paisan Dakulala. I am the Deputy Secretary for Health, one of the 2, and particularly responsible for public health and medical standards. After independence, the situation was manageable, but then over the years things, went down. It became an issue, and the time when we became interested in it was when it was a big struggle. The efforts that were put in, we were not able to, handle the situation. So that the problem became, if you like, the control was an issue. And so that's been the situation over the years. Today, we have just about, over 30,000+ TB cases in the country. And as per the understanding globally, in that setting, we are number 10 in the world relating to TB challenge, if you like. That's my understanding. WHO will explain a bit more on this. But in the Western Pacific region, the region that we share with the biggest country in the world, China, and then of course the smallest country in the world in the Pacific, that range, we are the number one, if you like. It's a huge challenge for us. And so there's a lot of challenge and efforts that we have been putting into to try and address this particular challenge.
Okay, I'm Peter van Maren. I'm the head of the WHO country office in Papua New Guinea. WHO is an organization that provides technical support to what we call member states, of which Papua New Guinea is one of such countries. WHO keeps on telling countries that, in order to address the problem of TB in your country, you cannot just rely on the Department of Health. You need to involve other departments because it is a social problem. It is a problem that goes much further than just being a health problem that affects families in terms of becoming sick. If you are in a poor family where you have one breadwinner, that breadwinner gets TB, then the whole family will suffer because of loss of income. The economic productivity is going down. If you look at it from that perspective, you will understand that the Department of Health cannot manage tuberculosis on its own. It needs the help of all the other departments in the country. It needs to have the support from society, from the people that the communities that are harboring all these tuberculosis cases. We need their support as well.
Some years back, this is in the mid-90s or so, when the Global Fund did come in. It did contribute not just to TB but to HIV and also malaria. So that particular inclusion has been very, very important in the way these three particular diseases had been affected. So funding had come in and support comes in that way. Other partners have contributed, and as you heard from what Dr. Van Maren alluded to, the technical expertise and the support that's coming through WHO is also very, very important and has been a big part. In fact, their expertise that they brought in those early years in the mid-90s as well has enabled us to strengthen ourselves and respond to the TB epidemic and enable us to see how we link up with the different partners and get us to be able to respond well. So yes, funding's come in, but it's a whole lot of partners also engaged in it, and DFED would have been a big part of it in terms of the contribution in terms of funding.
I think the key message for World TB Day is that TB is curable. If you go and get treatment quickly, as soon and get diagnosed quickly, then it's curable. And it's free to get that treatment. And so I guess for World TB Day, what I'd love everybody in this country is, if you have concerns about TB, go and get tested, go to see the doctor, and then if you have TB, keep with the treatment and you'll be cured.
The strategy nowadays, we are talking about ending TB. We are no longer stopping TB, but we want TB to be having an end date. So a global strategy has been developed that aims at 2030 for the TB epidemic to have ended.
And that's all we have time for on Olsem Wanem. If you have any stories or comments you would like to share, please send us an email via the address on your screen or visit our Olsem Wanem Facebook page. From the Olsem Wanem team, it's goodbye for now.